problem with patients receiving transplants is just simply put a scarcity of organs, period. There are about 100,000 people waiting for a kidney transplant right now, but we're only doing perhaps 25,000, 30,000 transplants a year. That leaves a huge gap and a long waiting list, and patients who are not able to receive a transplant suffer and their health deteriorates during that time.
My transplant journey began in July of 2019 when I was diagnosed with chronic kidney disease and moving towards end-stage kidney disease. By December of 2019, I found myself in the situation where I was having to start to do peritoneal dialysis every day. And that led to the beginnings of the search for a donor to make a transplant possible. Because I am fortunate enough to be in the business of advertising and marketing, I was able to put together a campaign to try to find a living donor. It became highly recognizable. And all of a sudden, we're getting phone calls from all over the country of people inquiring about, is it possible to help? A paired kidney donation is where you have somebody in your life who is willing to give you a kidney, but because of blood type or other health issues or match issues, they cannot give to you directly. So they make a promise through an organization to donate to somebody else. So at the end of the day, they found the living donor in another part of the country. The kidney was donated and transplanted into me in February of 2021. So it was roughly a 1.5 to 2 year process.
I think about Jeff and his circumstances, and he had a lot of resource available to him. There's so many people that don't know how to get the word out, and that's what is the biggest struggle. And so the process for receiving a transplant is complicated and very time-consuming. For a patient to actually become eligible for a transplant, they have to go through a transplant evaluation process, and then they're ultimately placed on a waiting list. From a patient perspective, another frustration is the waiting time once listed for transplants. It can be, on average, about 4 or 5 years, and it can be much longer depending upon blood typing or tissue typing.
What I learned in my journey is that deceased organ donation is driven by the population in a place, and you're more likely to get a kidney if you're in less populated states like perhaps Nebraska or Iowa, as opposed to California or New York.
What prevents people who need a kidney donation from asking friends and family for one?
I think privacy. Listen, you're asking somebody to give you a piece of their human body. This is not a cup of sugar to make a cake. This is a big ask.
I think that there's a lot of guilt when an individual has kidney failure in terms of relying upon other individuals for help. It really requires a lot of education. I think those in need to be aware that it is okay to ask for help and that it is safe for individuals to donate on their behalf.
If you can get past those things that are in your mind concerning and just say, okay, but I have more to do.
The only people that are not truly benefiting are the altruistic acts of the kidney donors. There may be barriers to donation. People have to take time off from work, people have to travel, and expenses out of their lifestyle to actually make it happen. I think public policy can really help create a net neutral act of donation. And I think overcoming some of those barriers through policies and government-supported funds can really help. And our system, unfortunately, has been built on waiting till the last minute. There is hope. I think that it really resides in slowing the disease process at an earlier phase, but also expanding the use of all of our technologies to improve living donation as well as deceased donation. If I were in a policymaker's shoes, I would be focusing strongly on supporting the living donor and the living donor perspective, and I would do everything I could to make sure that deceased donation was optimized at both the individual level as well as the structural level.
It is going very, very well. in my life today. Transplantation opens up new opportunities for a healthy, active, personal journey where you're really trying to take care of yourself and take care of that unbelievable gift that you've been given and be able to hopefully give back and make a difference in the world with it.
His example would be one to say, look at all that somebody had to do to accomplish this. Why are we asking our patients to do this? We need to figure out a way that it's not a burden that we place on patients to do it like this.